everybody. Welcome to the Dr. Mom Show. It's Dr. D, mom of 3. Thanks again for joining us today. I hope you enjoyed the introduction and learning more about myself and the goals of my show. I'm so excited that you're here with us again today. Today we'll be talking about a healthy pregnancy with your baby or babies. Shout out to those moms of multiples. It's all right. We always still give credit to moms of singletons too, because we all work really hard during our pregnancy. Don't forget to subscribe to the Dr. Mom Show channel, because within the first month if you subscribe, you'll be able to win a prize. We'll have a random drawing for one prize, and the most popular vote has been for a $150 Walmart card. So subscribe within the first month. Well, let's get started here. So let's talk about being pregnant. So when you're pregnant, I remember when I was pregnant, I personally loved it because first of all, you got to cut the best lines ever. You got to cut the bathroom line and you got to cut the food line. And everybody was always happy when they saw you. Intermittently, people want to touch your belly. Awkward at times when random people are coming to touch your tummy, but every time somebody sees you when you're pregnant, I feel like you put a smile on that person's face. So I personally really enjoyed my pregnancy, and if you're pregnant right now, I hope you're enjoying your pregnancy too. One thing about pregnancy that you can do is you get those cravings, and sometimes those cravings can be weird, as something as like dirt, or I've had one person eat soap before when they were pregnant, or they can be awesome, like hamburgers and ice cream. Some people don't even get cravings, but one thing you want to remember is that babies get everything that you put in your mouth. So you don't want to use your cravings as an excuse, because even though you can cheat here and there, you don't want to cheat all the time, because you want to give baby good things. Now remember that during your pregnancy, you also want to go to all of your prenatal visits. Your prenatal visits are usually with your OBGYN. These visits can be fun because at a lot of the visits you get pictures taken of the baby, and these pictures now, they have either 3D or 4D, so you can really get some cool images of the baby while you're pregnant. Remember that during your pregnancy, you want to make sure you take all the vitamins that you need. One important vitamin is a prenatal vitamin that has a multitude of things in it. Another thing is folic acid. Folate can also be found in leafy green vegetables like spinach, citrusy fruits, liver. I remember my mom wanted me to eat like chicken liver when I was pregnant. I said, no way, but it is a good source for folic acid. So if you like beef liver or chicken liver, you can do that. Also nuts or fortified cereal has it too. And the reason we encourage folic acid is because it helps the baby's nervous system, so things like the spine, to grow so the babies don't have any defects or anything when they're born. Another important thing is calcium and vitamin D. Just like us, this is very important for our bones, so we grow up nice and strong, so these muscles, these guns. And my mama drank calcium and vitamin D when I was little. And then also moms who breastfeed, it's also very important for vitamin D, and we'll talk about that in another show. And another thing is iron. Basically, you really just want your diet to be well balanced. So fruits, veggies, you want enough fats, carbs, starches, and protein in your diet, because remember, your calorie intake is going to go up because baby's in there, baby's hungry, you're hungry. Normally your calorie intake can go up to about 300 to 350 calories a day when you peak, so you will be eating more. Going into that, of course, if you're eating more, you're going to gain weight. Now, with that being said, you don't want to gain too little weight, but you also don't want to gain too much weight. Normally, pregnant women can gain up to about 20 to 25 pounds. It just depends on what your pre-pregnancy weight is. If you're starting out larger, usually your doctor will probably recommend less weight gain. And of course, if you're smaller, they'll recommend a little more weight gain. But again, if you're too little or too big, that can also affect the baby too. The other thing is, while you're pregnant is make sure you stay active. Being pregnant isn't a disability. Come on, ladies. You know, you got to show it off when you're pregnant and show these guys that we can still do our regular activity. So get up and move. Of course, you just want to be careful because you are carrying more weight. So of course, your heart rate goes up. Sometimes you get a little short of breath a little bit sooner than you did before you were pregnant. But again, you still want to stay active. You can walk, take a long stroll with your honey bun in the evening, and spend some time together. Again, just don't sit around, because walking and exercising can help the pregnancy go better. Other things that are good while you're pregnant, like I said, are good calories. I remember when I was pregnant, because I had the triplets, I had to gain 60 pounds to keep those babies in there. And I'm telling you, it was rough. Initially, it was easy because I was like, oh yeah. But then after a while, because my tummy was getting big and they were pushing up on my stomach, I could barely eat because my stomach obviously was smaller than it was before, just because they were pushing up on it. So what I did, I had to drink a drink that was high in protein and calories. Shout out to that company, because what it was good calories. So when I wasn't pregnant, after I delivered, I was able to lose that weight. And that again is a good thing about if you gain good calories. After your pregnancy, you're able to lose that weight much faster than if you gain bad calories. So hence, don't eat too much ice cream or too many hamburgers. So some things during pregnancy you want to avoid. As far as foods, you don't want to do any raw meat. So a big thing is you always want to wash those hands, wash your vegetables, wash your fruits. Also, again, no raw foods. Sushi was my downfall. Towards the end of my pregnancy, I was like, oh Lord, I could go for some good sushi, but I toughed it out and I didn't do it. And you want to be careful with undercooked meats, so make sure no raw eggs, like I said, sushi, no raw fish. Other things are unpasteurized dairy products, so no goat cheese. One big thing is queso dip. I have one friend, she always says she can suck queso dip through a straw because that's how much she loves it. But obviously when she's pregnant, she won't be able to do that. Other things you don't want to eat are fish that are high in mercury, and those include fish like mackerel, shark, also tuna. Tuna does have mercury in it, but it's lower in the amount of mercury that it has. So you are able to still eat tuna, but we usually recommend only about 5 to 6 ounces of tuna each week if you do eat it. Other things, of course, include not taking illegal drugs or alcohol or smoking cigarettes while you're pregnant, because again, all of these items go to your baby, and babies can't go through withdrawal just like adults who do use illegal medications. And that'll be another show that you would love to see when we talk about that and how we take care of those babies. As far as medications when you're pregnant, usually physicians recommend acetaminophen or Tylenol instead of anti-inflammatories like ibuprofen or Motrin. And the reason that is because anti-inflammatories decrease how big our blood vessels are, so then the baby doesn't get as much blood, and a lot of times it can affect the baby's blood flow to its heart. So remember, when you're pregnant, really try not to take one. We recommend try not to take medicines if you don't have to, but let's say you have a headache, do the Tylenol and acetaminophen. As far as antibiotics, there are some antibiotics that are safe, so you would want to consult with your primary care physician or your OBGYN. And again, like I mentioned, pain medicine like opioids, things like Percocet, Norco, things like that. I know some people get really bad back pain or contractions when they're pregnant and they're given these medicines, but please remember that these medicines can go into the baby's system also, so you really want to ask your physician a lot of questions and how that will affect the baby after the baby's born. And lastly is vaccinations. When you're pregnant, if it's during flu season, we do recommend getting the flu shot. Just because when you're pregnant, your immune system is down. We call that immunocompromised, and all that means is that you're not as healthy as when you weren't pregnant. So you have a higher chance of being in the ICU if you catch the flu. And the last vaccination we recommend is the tetanus with the whooping cough, the Tdap. And that reason is because babies don't get their first whooping cough vaccination until they're 2 months old. And what studies found was that the highest number or incidence of babies with the whooping cough or pertussis were babies who were less than 2 months old. So they found that if moms got vaccinated when they were pregnant, that the babies had a decreased chance of getting pertussis or the whooping cough before they were 2 months. So you do want to protect your baby. And of course, if you have further questions, please, you really need to address this with your OBGYN or primary care physician. Well, again, I'm so excited that I was able to tell you how to have or plan a pregnancy that's healthy. If you have any questions, again, just post any comments or questions that you have or any other topics you want me to address about your pregnancy or upcoming pregnancy. Plan. And then we have a super big surprise for you at our next show. We hope you join us because we'll have 3 little guests. And then, of course, don't forget to subscribe to our channel because at the end of the first month, we'll be having that giveaway of a $150 Walmart card. So remember, wash your hands, kiss your kids, love your family, and say your prayers. Bye-bye.